what do you do if you've been exposed to trauma and it lives in your unconscious mind and it causes you chronic stress on a daily basis because you have not healed that wound, that emotional wound?
What happens?
People get IBS and Crohn's disease and ulcerative colitis. And I've had many patients.
Leaky gut too?
100%.
Wow.
Because what I'm giving you are the diagnoses, but the root cause is a damaged gut with leaky gut.
So the symptoms or the diagnoses, I guess, are the damaged gut, but the root of that is a lack of healing, an emotional trauma.
I've had many patients. These are actually my proudest moments as a doctor, to be completely honest with you. My proudest moments are not getting people to change their diet. My proudest moments are taking that person who has been to 6 or 7 doctors and they're not getting better even with medication. And you build a doctor-patient relationship. It's not one visit. I'm talking about 4, 5, 6 visits. And you get to a place where they tell you something from their past that is still affecting them today. And my role as the doctor is not to fix that specific issue. It's to bring awareness to them so that they understand that these are not separate issues.
Wow.
And once they discover that, then actually treatment is like next level because they actually turn their attention towards the thing that they've been avoiding or ignoring. They turn towards that. And they have a healthcare professional, not me, that's not what I do, but they have a healthcare professional who helps them to heal that wound. And when they heal that wound, these are people that have been doing 30 different plants, exercising, deep breathing exercises.
They're still not
everything.
Their gut is still messed up.
Gut's still not messed up. Dr. B, I've done everything your book tells me to do. I'm still messed up. Okay. Once we discover this, the healing is a rocket ship.
It's like within days, it's like transforms.
They are completely transformed because everything is right, but it's like that rocket ship is chained down.
Wow.
It's chained down. So it's trying to go off, but it can't go off because of these chains. And you got to break the chains that are holding them back. And that is their history of trauma.
Man, isn't this fascinating that you could do all the right things physically, but if you don't heal emotionally or psychologically and allow your nervous system to feel safe, you can't take off as a human being.
100%.
That is fascinating. And that's why I just believe that learning to face yourself and address the emotional, psychological, or memory wounds that you're holding on to and processing those things that can take time and healing those things emotionally will set you free physically as well.
I think this is the missing piece that a lot of people haven't heard and they need to hear.
Wow. It's almost like doctors, if they had also training on therapy, how to implement that type of process. I guess you couldn't be trained therapists, but some type of training. It's almost like that could also elevate healing better.
I'm a believer in a teams-based approach to healing. That there's not going to be that one
person that can do everything.
Person that does everything anymore.
Yeah.
That you need to surround yourself with a team of competent people that you trust and you have faith in.
Gosh.
And work with them. But it's I want to give a quick shout out to one of my mentors at the University of North Carolina. His name is Doug Drossman. And he is the founder of irritable bowel syndrome. So he wrote the book. It's called The Rome Foundation. And basically it was like a group of scientists that met in Rome, Italy for the first time and like put together this idea of what IBS is back in the 80s.
Wow.
So that was Rome 1, and they've gone through, and I think they're on Rome 4 now. So basically, but he's the author. He's the guy that has organized this and led this, created this diagnosis. I worked in his clinic. The hospital hated us. We would see 2 patients in a half of a day. Most gastroenterologists these days see 2 patients in 15 minutes.
Really?
Yeah. We would see 2 patients in a half of a day. We would spend hours with these people. But these were the people that I'm describing that would bounce from doctor to doctor and never get better. And the system was failing them. Because you can't just use a pill for everything.
Wow.
You can't just make a diagnosis and fix everything. At some point, someone needs to have a holistic view and see the complete person and see that we are more than just this one, set of symptoms. And that's what we did. And he was quite interesting because he was a professor of both medicine and psychiatry, and I would call him a maverick. because like he's back there in the 80s and 90s and coming up and making connections, like, you know, for example, history of sexual abuse in childhood, connecting that to the manifestation of digestive disease as an adult.
Wow. I mean, that's something I talked about on this show many times, about dealing with sexual abuse as a 5-year-old, and how it left me feeling very unsafe and clinched a lot, and kind of like always looking out to see who is going to try to attack me, abuse me, take advantage of me in different social settings, even when it wouldn't be a sexual abuse setting, but just a setting of like school setting, right? Sports, whatever it might be. And I believe that was a big part. Like, you know, 4 or 5 years ago, I started really diving in deeper on sexual abuse healing. I started about 11 years ago, but didn't fix the teeth, and I still ate poorly as well. But I started to kind of put it all together 4 or 5 years ago with fixing teeth, intentional eating, eating healthier, healing trauma on a deeper level. And I feel like it's allowed me to have more freedom within my body as well, peace and harmony. Someone asked me this morning, how are you feeling today at the gym? How are you feeling? And I had another guest on earlier today where I told him I always tell people the truth about how I'm feeling. So if I'm not feeling good, I'm like, man, I'm messed up right now. I'm stressed out. I'm this. Like, I'm honest with how I'm feeling. I don't just say good for every answer. And I said, I'm feeling peaceful, loved, abundant, grateful, and harmonious. And it's how I feel.
Sounds amazing.
But it's been willing to face incredible amounts of pain within myself, address it, not just once and be done, but consistently for the last 4.5 years.
Yeah.
Almost weekly. And being willing to face it and process the pain to create meaning, to process shame, guilt, insecurity, and whatever else I was holding on to psychologically, emotionally, physically from the different traumas of life, and allowing myself to self-love without shame anymore. And it has been one of the most challenging processes I've ever had to experience, but the most liberating and freeing process. And it's a journey that will continue. I feel better. My gut has reacted better. And I only feel like I can improve from here as well and continue to get better. So I'm so glad that you, as an expert in this field, as a doctor, medical doctor, talking about healing the emotional traumas can sometimes be the final thing that allows us to elevate our physical potential as well.
It's people like you that have the ability to change the lives of millions of people, because you sit here and you speak with openness about a difficult topic for you. And that requires courage and putting yourself out there. I appreciate that you do that. And there's an interesting thing that you said just a moment ago that I can't help but comment on real quick, which is that you talked about feeling like tensed up.
Clinched.
Yeah. Is the word you used, right? It's actually not a coincidence that constipation is actually the manifestation in many cases of that kind of trauma, because that feeling of clinched, actually, like you truly are.
Yeah, constantly.
Yeah.
I mean, I constantly was.
Right.
I don't attach that to myself anymore. But in my years growing up, in my teens and my early 20s, it was a clinched feeling. It was almost like I was ready to fight at all times.
Right.
It was like waiting for someone, wanting to trust and love the world, but waiting for someone to take advantage of me at the same time.
Yeah.
And it wasn't a relaxed state of being.
How can you trust when you're a 5-year-old who's vulnerable and exposed to something like that? That's really hard. And as an adult, we're constantly struggling to overcome those types of experiences that we have. But I just find it interesting that the words like this, like clinched, you're intending it figuratively, but it actually is literal.
It is literal. It is, and it caused digestive pain.
Yep.
You know, and it's hard to go to the bathroom. It was
This is what I'm saying.
Sitting there for 20, 30 minutes at times, you know, being like, how am I going to get this out? You know, it's just like, but like you said, going back to the breathing, like just activating the breathing alone for 10 minutes a day will allow you to relax your mind, your nervous system, your body, and connect it, your gut as well, so that you can process everything better. You add the exercise, you add the food, but I feel like the fourth thing, what I'm hearing you say, I don't know if this would be the fourth thing, would be healing emotional wounds, healing trauma. And you could do the first three, food, exercise, and breathing, but it sounds like a lot of your patients, until they healed the trauma, they still struggled with their gut.
Yeah, I don't think this is everyone.
Yes.
But for people that have something in your past that you're still struggling with, and maybe you've repressed it, right? Maybe you're not thinking about it,
Yeah.
but it's there. If you have something like that, I just want to bring awareness to the fact that this is not something that you're able to hide and put away to the side. It's continuing to affect you, and to be the best version of yourself, the best thing that you can do is reach out for help and address it directly.
Wow.